Hi, everyone. It's noon on a Wednesday, and I am live here moderating a panel for the Asian Community Development Council. So good to see everybody here on Facebook with us today. If you've been watching us for a while now, we put on the series every week to help get out the word to our community members, especially our AAPI community members who are followers of Asian Community Development Council, what we do. And also we work with different groups, agencies, nonprofits around Nevada to help bring you the best services to help educate, connect, and empower the AAPI community. And today we're actually joined by some very special guests. We have folks from the Health Plan of Nevada joining us today. We have Richie Duplashane. He's the Director of Medical Outreach, and he's going to be talking with us in just a little bit, explaining about what he does there at Health Plan of Nevada. We also have with us today Elizabeth Maya. She's the Community Outreach Specialist of Health Plan of Nevada. And we also have with us Joy Avendano. She is with the Asian Community Development Council. She is one of the health navigators at the agency. So we're going to bring Joy in here in just a little bit as well. But first, let me start here just to introduce what Health Plan of Nevada is all about. If people are not familiar, I know you guys work closely with ACDC among other agencies. So why don't we start with Richie? Richie, if you want to just kind of give us a brief overview, people who are not familiar with Health Plan of Nevada at all, what is your organization all about?
Well, thank you very much for having us on here. First of all, we really appreciate the opportunity to come and speak to your audience. So a little bit about Health Plan of Nevada. We're one of 3 managed care organizations that are part of the Medicaid program for the state. And so what we do is we are able to assist our members with Medicaid, offering special benefits. But more than that, we are part of the community. We were born in Nevada. So helping our members in our community mean a lot to us. Our department as a whole, and Liz will definitely talk more about this, we're like a nonprofit side of a for-profit company. Not only do we get to help our members, but because of what we do and the resources we offer, we're able to help out everyone in the community. And you can only do that by creating relationships like ACDC in our community, so that we can stay on what is needed for our community. It's folks that are meeting the members and the community every day that have a better understanding of what is needed today, not next month, or what was needed last month. So what Health Plan of Nevada does is they are part and immersed in the community, and we offer health care following the Medicaid guidelines provided by the states, with extra benefits that we understand that our members need, especially focusing on not just clinical. Everyone has clinical, but we focus on the social determinants of health barriers that our members face every day, from just making sure there's enough food, to housing, to job, to just getting from their home to a grocery store and back. Little things like that. That is what concerns us. And this is why our team is so involved with every partner in the community, because our community means something to us, but we can only help each other if we know what's going on. And it takes a village, so we definitely want to be a huge part of that village.
That's great. Thank you so much, Richie. Let me bring Liz in here really quick, because I know, Liz, you're part of the community outreach, right? You do marketing for Health Plan of Nevada. You're kind of well-versed when it comes to exactly, how the community is reacting and the need that's out there right now. And you prepared a presentation for us. I think this will be helpful because it kind of gives an overview too of the kind of help and services that are out there right now. And we'll have some questions for you after. But Liz, why don't you start this presentation and talk to us a little bit about what you do there too?
Well, over the past couple of years, this team has been together for maybe about a year and a half now. And so our focus, because we are, of course, part of Health Plan of Nevada, and we've been in Nevada for 30 plus years, we're very invested in the community. We focus not just on our members. I mean, we are under the United Health umbrella. So we have United Healthcare, we have Health Plan of Nevada, we have Sierra Health and Life. Chances are you know somebody that has one of our plans, be it through Medicaid, through their employer, a plan that they pay for themselves, a Medicare plan. We cover the entire family. So I'm very proud to be part of this organization because we work not just to facilitate services for our members, but we also try to facilitate resources for the community at large, which is how we met Vice from ACDC, how we went on to meet with Vida, the director, and the ACDC, the Asian Community Development Council. We were so impressed by all the services that you offer. And because we constantly run into folks that have questions about where they can get certain services, ACDC is now one of the partners that we refer to, especially my being bilingual. I encounter a lot of our Spanish-speaking population. I tell them about ACDC because I know that you help everyone. I tell them about the citizenship classes that you can assist with. I tell them about the legal services that you can assist with, that you have navigators. The college prep program that you have, I think, is fantastic. And I think we need more of that here in Las Vegas to help our youth, because that's our future. So all of these services that ACD offers, that's an example of how we work with our community partners so that we have this information available when we're out there working with the community. We have someone that we can connect them with. And in turn, we work with you to make sure that if you should have any of our members or anyone that has questions about Medicaid or healthcare in general, that you have a contact that you can reach out to us so that we can assist. We may not have the answer to every single question, but we've formed enough relationships in the community now that we have somewhere we can refer to.
Yeah, that's great. And Liz, we have the presentation up now on the screen. If you were kind of through this, and we'll let our staff here just kind of roll through the screen with you as you're talking through it. So just go ahead and keep going with the presentation. And I think this is going to be some really good information for all of the people watching right now.
Right. So this just a quick overview. As I said, Health Plan of Nevada has been here in Nevada for 30 plus years. As a result, we have built up a large membership and also a large provider network. So we've got over 250,000 members. We service Clark and Washoe counties. And if we could just move on up to the next slide. So this slide really just gives you a little overview of Medicaid benefits. We encounter individuals in the community all the time that don't know what Medicaid is. They don't know that they may qualify for it, and they may have a need for it. So this just kind of glosses over the basic Medicaid benefits. So there's, of course, medical, there is dental, there is vision, and MTM is actually the contracted transportation company in Nevada that actually helps them get to the appointments. A lot of people that have Medicaid are not always aware that this service is there for them. And they can help with bus passes, with rides. They also do mileage reimbursement. And as I mentioned, also, we have the largest provider network in Nevada, and that's simply because we've been here so long. We've built up a lot of great relationships with different provider groups in the area. Next slide. Okay. So one of the things that someone asked me recently was what we do for our members, aside from just the basic Medicaid services. So our health plan, and I'm proud to say this, looked outside the box when it came to adding certain benefits and support services. Because as it says on the slide there, we take the whole person care approach when it comes to their well-being. So we have, not just on the clinical side, we have case managers that will work with adults, with children, first-time moms, or anyone that's going through a pregnancy that needs some added support. We also have licensed social workers that can get involved if the situation is such that they need help navigating that system. We have disease management. So for individuals who are facing diabetes or asthma, COPD, we have nurses that actually work with them to help keep these diseases under control. And we also have, and a lot of people don't know this, we have inpatient case managers. So if you're in the hospital, our inpatient case manager is there to make sure that once you get ready to leave, that all the services that you're going to need for follow-up are in place so that somebody can help you navigate that process. Next slide, please. Okay. And one thing that a lot of folks don't know about, especially right now, because we're still in the midst of this COVID-19 pandemic, we want to try to encourage people to stay safe. We want to encourage them to stay home, right? If you don't have to go out, you really don't want to right now. We have a 24/7 nurse advice line where you can call if something comes up and you're not sure what action to take. The nurse advice line, they will do a mini assessment with you to determine if it's something that you need to go to the emergency room for. And if it's not, if it's something that can be handled via urgent care, we have options now that are so convenient. We have the Now Clinic, which is our 24/7 virtual visits, which you can do on any device, be it your phone, your laptop, your tablet. We have our mobile medical center that goes to different parts of the city, either with adult services and mammograms or pediatric services, and they can also do immunizations. During flu season, we offer the flu shot. And we also have 2 urgent cares that will come to your house. So there's Dispatch Health and Ready Responders. So if the nurse advice line recommends that as an option, they will come to you. And then they will send your prescription to the pharmacy. That's all you need to do is go pick up the prescription. And also Walgreens now offers delivery for our folks. And we also have, aside from MTM, we have our own transportation program, which goes on to this next slide with the added value benefits. So, for example, your doctor's appointments, dental appointments, MTM can help you with that. But a lot of times families are going through different situations where they may need assistance. Maybe they need help getting to a food bank. Maybe they need help getting to social services. Maybe you've got someone that's looking for employment that needs to go for interviews or job training. We have an enhanced transportation program that can assist with that. We pay for the high school equivalency tests. We also pay for Boys and Girls Club memberships and identification cards. We have had situations where we have had individuals that lost their IDs and for whatever reason, maybe don't have the ability to pay for them. So we help them pay for those identification cards and we help get them to the DMV if needed. We also have health education and wellness classes. This goes back to helping those that may have things like asthma, especially diabetes. Diabetes right now is very big, especially in the minority communities here in Las Vegas. And I don't feel like there's enough being done to educate them and help them understand how they can manage that disease. So we've taken upon that task with our health education and wellness classes. And as I mentioned, we take the social determinants of health into consideration when we're putting all these programs together. This is another plan. Somebody had asked whether we offer any type of reward programs or incentives for our members, and we do. Especially, we want to encourage our families with children to make sure that they get all their follow-up checks, all postpartum checks, their immunizations. So we do offer a Visa gift card program, healthy pregnancy rewards, we postpartum visit rewards. We want to encourage our moms to use the services that we offer. We have a pregnancy application, which will help them throughout the entire pregnancy. We help with breast pumps, lactation counseling, and we have a team of OB case managers that can actually follow you throughout the pregnancy up until you deliver, to make sure that you get all the services that you need. And if you should need any other type of support from our community health worker or social worker, they will also connect you with that service. Another thing that we really try to focus on is support for mental health. So this is our behavioral health model of care. If anyone should need any assistance, we do have access to same-day appointments if they're going through some type of a crisis or a traumatic experience. We also offer telehealth. we have coordinators that will help them with their appointments to make sure that they don't just have the appointments, but they also have a way to get there. And our case managers will follow them for as long as they need the support to make sure that they get the appointments, and not just for mental health, but any other type of social needs that they may have. Okay, next slide. Okay. And this talks about the member support that we have 7 days a week. As I mentioned, our 24-hour nurse advice line can also field any of the calls that involve mental health issues. And our case managers are there to help them connect with services. And this just discusses some of the services that we can help them connect with: medication management, outpatient therapy, pregnancy, the PROUD program, which is the pregnancy rehabilitation for opioid use disorders. We need to make sure that we support any of our moms that are going through that process of recovery, especially during pregnancy. Next slide. And these are some of the important numbers that we try to provide for our members, or anyone that has any questions about the services that we have. The behavioral health and substance abuse hotline, the 24-hour nurse advice hotline. I always make sure that all of our members have that information. The Now Clinic, our member services department, and I'd like to stress that our member services department is here in Las Vegas. You call someone local. You don't get bounced around to another state for the call center. They're here in Las Vegas. They also offer in-person services. Right now, that is on hold because of the COVID-19 pandemic, but we hope to get that up and running once things start to clear up. And then we also have our OB hotline for our expectant moms. Okay. It is open enrollment. So right now, because of the COVID-19 pandemic, they did extend that. It usually ends June 30th. This year it ends August 31st. And they can, anyone that's interested in information about our plan can visit our site or call that number for any questions about the services that I just discussed. And that is our team. You've got Richie Duplashane, you've got Liz Maya, and you have Sarah Portillo. Sarah and I both are out there doing community outreach, which involves sometimes coming out to events to support the community. Sometimes we volunteer at events for some of the community organizations. Sarah in particular has in the past couple of years organized health and resource fairs at some of the library branches here in Las Vegas to bring those resources to the community. She's also worked with Sunrise WIC and the Las Vegas Urban League. We're working on, we do outreach with them at their locations, and we also try to work with them on community events. I don't know if there's anything that I missed, Richie.
No, you seem to have covered it all. You did a great job. And as you can see, our case management that we have as a company is almost overwhelming. We have more case management than anyone else. It's important to us that our members actually receive the help they need. And what's wonderful is our case management is actually able to go where the member is, even in their homes, Starbucks, McDonald's, or support centers, wherever that may be. So,
all right. Thank you so much, Liz,
you.
for that presentation. And as you can see, I brought Sarah into the conversation. Liz gave her a little bit of an introduction there. But Sarah, since you're here, I know you do a lot of work with the library district, right, in terms of getting the word out there. Can you talk to us a little bit about that?
We're just working with the library district and different community partners. We'll set up a health and resource fair to reach out to not only our members, but the whole community to get them different resources that they need. We'll invite different partners like Goodwill, even the Culinary Academy. We will invite FIT, we'll invite the Urban League. So those are all resources that we can share with our members, but the community as a whole. Training classes, job resources, daycare resources. So that's kind of what the focus is is on.
That's great. Yeah, you guys really do a lot of good out there in community. I think right now a lot of us are doing things virtually. As you know, we're doing webinars because so many people can't meet people in person. You know, that's why
Mhm.
it's so important to do this. And we're actually getting some questions in, and I'm going to get to that in just a minute. But first, I want to bring in Joy. She's been listening in here patiently, and I want her to give Joy a chance to kind of speak out about her role as a health navigator at ACDC with the Asian Community Development Council. So first, Joy, welcome to our webinar and talk to us a little bit about what you guys do at ACDC and your role there.
Okay, hi everyone. First of all, I'd like to commend HPN. I'm proud that we are collaborating with you because in the beginning, people will think that a private company is only for profit. No, that you do have a corporate conscience by your outreach community program. And I think you're the biggest single carrier in the US. That's why you can afford to give cheap rates or affordable plans. And most of our plans come out of Nevada Health Link is mostly HPN, because you really offer affordable ones. Yeah. I'm Joy Avendano, one of the health navigators for ACDC. What we do is we partner with the Nevada Health Link in helping to enroll those who do not have or lost their health plan coverage. And also, it's glad to know that we are collaborating with HPN with all their outreach programs. So let me tell you that according to survey, about 40% of Nevadans are uninsured. And one of the reasons is because they lack access. And the purpose of being a nonprofit organization is to help them out. And we do this with our outreach program and events in collaboration with Nevada Health Link and HPN. Glad to know. And then in these events, we get inquiries on how to enroll and we help them. And as you know, enrolling in a Medicaid is quite confusing, and we are there as health navigators to help them. As they say, navigate. That's why we're navigators through the process of enrolling. Yeah, and we help them from step one up to the finish line, and after that, we still help them if they get in touch with us. That's why we're here as nonprofit organization, Asian Community Development Council, or AC.
Yeah, thank you so much, Joy. I think our signal is a little tough with Joy, but yeah, we're gonna try to bring some other people in from ACDC as well. But yeah, ACDC has been such a great partner with Health Plan in Nevada, and I really wanted to kind of amplify that this relationship is especially so important right now, just because of everything that's happening. Of course, the big concern right now that a lot of people have is with COVID-19, getting testing, getting medical care, especially if they lost their job and their friends and families are affected by this. So I'm going to bring Richie in here to answer one of the questions that we have. So one of the questions coming in on Facebook Live right now, by the way, we want to remind people, if you have any questions, definitely write your comments on there. We're going to try to answer this. So one of the questions we have, and I'm going to have Richie answer this, is will Health Plan of Nevada cover COVID testing, antibody testing at this time? What can you say to that, Richie?
Well, at this time, we're following state mandated coverage. And as of right now, they have not gone to the antibody testing. I don't know if there's some organizations out there right now that are doing it for free, but we will definitely research that and get back to you so we can let you know who those are.
Are you hearing a lot of concerns, Richie, when it comes to this, especially working in the healthcare field right now when it comes to COVID-19?
Actually, you know what? That all kind of went down at the beginning. Everyone's like, oh, I may have already had it. I need an antibody test. But now that they came out and they said, well, if you had the antibodies, it's only good from 3 to 6 months, that it kind of recycles and you can still catch it again. I don't think people are as worried about the antibody test as they have been, because we really, I don't think that this was the first time I've received a question in probably a couple of months.
Yeah.
So it
But it's
hasn't
good.
been a huge concern. I think the biggest concern is, are we doing enough to keep people protected? Do they have opportunity to get their own personal equipment so they can venture out into the public? And what are we doing to bring services to folks so they don't have to be out and about and getting in big groups of people?
Yeah. And as we're bringing everybody on, if you're just joining us on Facebook Live right now, I just want to show everybody on screen. We have people representing from the Asian Community Development Council, a nonprofit, nonpartisan agency right here in Nevada, in Las Vegas. We also have an office in Las Vegas and in Reno as well to help the AAPI community, especially, but we help everybody who basically needs the information when it comes to different services. And among them is healthcare. We connect them to different health plan groups in the state. And we're actually getting another question, and this is going to be a good one for Liz. So Liz, why don't we come to you? One question from Facebook we're getting right now is, will there be any changes when it comes to maybe later this year or next year when it comes to rates for Health Plan of Nevada? Can you address that?
Well, right now, we're actually going to be gearing up for the open enrollment. It sounds to me like this has to do with the individual plans. So for the individual plans, what we have right now is what we're going to be offering for the remainder of the year. Now, I myself have not been made aware of any changes for 2021, but we always are assessing the needs of the community, what services can be offered. So there is a possibility that there may be a change for the start of next year. And your navigators are always welcome to reach out to us. And if they're not already connected with somebody within the health plan that works directly with the individual plans, we are always more than happy to get that connection going, because we want Joy and anyone out there who's assisting the community to be able to have those resources so that they can serve the community to the best of their ability. So please reach out to us. And like I said, if we don't have the immediate answer, we can definitely get you to someone who does.
Okay.
Yeah, and if I might add to that,
yeah, of course.
Our vice president for individual plans, Rhonda Check, and her team, I know that they are putting together their packages for the open enrollment, and so that information will be coming out. I believe at the beginning of October is when they start, or they're able to go ahead and give that information out. And if Joy and her team are not already included, we will make sure they're top of the list.
That's great. Yeah, and it's great because let's talk to Sarah for just a few minutes, just to talk about, we're getting people really familiar with Health Plan of Nevada, just one of the companies working to help people. So what are you hearing out there for your clients right now too, especially with COVID-19, people losing their jobs? What are the biggest concerns and challenges out there for them, Sarah?
Some of the biggest concerns, of course, is getting to their appointments, the resources that they need for housing, not having that income anymore, not knowing where to get food. So that's been a major concern. So we send out a weekly resource email to all of our community partners, sharing different resources, whether it's about immunizations, different food distribution sites. Like, for example, Nevada Power and some of the resources that they have for their for their clients. Share different daycare resources that are open to those who are able to work right now. CCSD has a lot of messages, surveys going out, so we're trying to share that. So it's just a lot of unknown, where to go, who to contact, things like that. So we try and share those resources to make things a little bit easier for the community.
Yeah, and I
just
want to jump in here too, yeah?
Yeah, I was going to just add to that. We've also partnered with our individual sales team and commercial, because we understand there's a lot of change happening. Unfortunately, a lot of furloughs that have occurred and possibly to even occur in the future. So we're bringing all of our information together so we can help our commercial partners to educate those leadership as well as their staff on the possibility of resources that are out there, and keep them aware of their choices if there is going to be a change in their insurance. How do you get to the individual plan? How do you get to the Medicaid plan? Who do we reach out to resources like ACDC and other partners in the community. So we're trying to educate all of our partners, even though it has nothing to do with Medicaid right now, but it could happen in the future. So we're just, all of a sudden, it's like those lines that were never crossed before. We're like, hey, wait a minute. We have a lot of opportunity here to educate folks before something happens. So thankfully, we've been doing that and sending mailers out, working with these different, the casinos and other businesses to make sure they have all the information they need in order to educate and give that information to their team members.
Yeah, that's great information. And we're getting some new questions in here on our Facebook page as well. And one of them is in Vietnamese, and one of our staff members, of course, we're a multi-language agency, has translated for us. So Liz, I'm going to have you come on here and answer this question from one of our Vietnamese clients. They're saying that my friend will be losing his job at the end of the month. Can he enroll in health insurance with Health Plan of Nevada for next month? And if they can, what's the best way to contact you?
Well, the answer to that is yes. There are going to be services available for. We're bracing ourselves because we know that there are probably going to be another round of people being laid off, furloughed, losing their benefits. So, of course, there is a process for determining what you qualify for. And these are the instances when I was talking about our community partnerships, because we try to encourage, if they have lost their employment and they have no income, they can apply for Medicaid as long as they meet those guidelines for Medicaid. They can apply. If someone were to apply for that today, they usually let them know on the spot, whether it's over the phone or in person, if they meet those guidelines and if they're going to qualify. And then, as I mentioned, they would get the medical, the dental, and the vision. In some instances, you have folks that maybe are on that borderline, but as we discussed earlier, there are also certain programs where they can sometimes qualify for a subsidy, and that's one of the reasons why we have them sometimes go through Nevada Health Link or directly to DWSS. I understand that the language barrier can sometimes pose an issue. But from my understanding, there are a few groups in town, including yours, that have navigators on site that are multilingual, so that these folks can come in and get some help.
And that's a great actually segue to our next person that I actually want to bring on to our conversation right now. So I know we met Joy earlier. She speaks Tagalog. We also have Ann Apellido with ACDC. You can turn your microphone on for us, and I'm actually going to bring you into the conversation here since we have all of our staff members here. So Ann, talk to us a little bit. Maybe you can share with us information in both English and Tagalog in what you guys do and why it's so important to have a partner like Health Plan of Nevada to work with us here.
Okay. Hi, everyone. I'm Ann Apellido from the Asian Community Development Council, and I am a program coordinator of family services as well as a licensed health navigator also. So like what Joyce said earlier, we are partnered with Nevada Health Link, and Nevada Health Link is a state marketplace health insurance for you to enroll in health insurance. Whoever who doesn't have health insurance, we can help them. And we have 3 health plan carrier in Nevada Health Link, which is the Ambassador Silver Summit, and one of them is the Health Plan of Nevada. So as a navigator, we are helping everyone to navigate in a health insurance according to their needs. And a state is giving an APTC, which is Advanced Premium Tax Credit, to help them pay for a lower monthly payment. And as a health navigator, we are offering free health insurance assistance. Plus, we have a bilingual navigators. We have Tagalog speaker, Spanish, Vietnamese, and as well as a Visayan speaker. And we have a colleague that can help you with languages such as Chinese, Mandarin, Thai, and Japanese, and also as Korean as well.
That's awesome. Do you want to say maybe something in Tagalog for people who are watching out there who may want to we want to outreach in Tagalog as well?
Okay, yeah, ako po si Ann Apelido from Asian Community Development Council. Isa po akong health navigator. And nandito po kami para tulungan po ang mga individual na wala pong health insurance para po makapag-enroll sila sa health insurance ng nasa mababang halaga dahil po ang state ay nagbibigay ng advance premium tax credits, which is ang platform po na ginagamit namin is Nevada Health Link. Naka-partner po kami sa Nevada Health Link. And isa po sa health insurance ng marketplace is yung Health Plan of Nevada.
Awesome. Great. Thank you so much, Anne. Yeah, Anne can speak Tagalog. Joy can also speak Tagalog. We have our Vietnamese translator right now working the questions that we're getting in Vietnamese. So definitely so glad to be reaching out to so many people. And I know there are questions with Medicaid that I'm going to have you guys talk about it in a little bit. And we have a video, a short video to show you when it comes to questions with Medicaid. So I'm going to have our staff member, Michelle, roll that video for us right now.
Awesome.
All right, so that video is supposed to have audio on it, but for technical reason, it's not playing. But you get the information. So basically, it has to do with your Medicaid. So, Richie, I know you're the director of Medicaid Outreach. Do you want to talk to a little bit about what we could have heard on that video?
Absolutely, absolutely, and please feel free to share the link with everyone. You can hear the volume and you can hear what is being said. Well, and basically, it's we're following state rules, and this is how you sign up for Medicaid. Medicaid, you cannot sign up with any managed care organization. You have to sign up through the state. So basically, it talks to how who might be eligible and how you sign up. It's funny because Medicaid has been around for a long time, but it doesn't fail every day. People just don't realize how to sign up, or even if they would be eligible. A lot of folks didn't realize, it's great for in between jobs. If you're going from one job to another, or maybe your business is shut down a little while, especially now during the pandemic, you could be eligible for Medicaid. If you're a student going to college and you're not working and you're not a dependent of your family, you could be eligible for Medicaid. If maybe you're not eligible, but your kids could be eligible. So you should really sign up, especially working with groups like ACDC, who can actually help walk you through the steps and get you to the right information and to the videos, and probably speak your language. They could help you understand better, or working with a group like ACDC. So it's very important, especially now, for folks to understand that you need to understand that you can sign up for Medicaid. Even if you're not eligible, then you might be eligible for a plan on Nevada Health Link for subsidized insurance, which the navigators can help you to get that done.
Okay, great. Thank you so much for addressing that, Ricky. We'll make sure our staff will put the link to that Medicaid video on our Facebook page. We actually just got another question coming in. I think Liz can answer this one for us. We have lots of people listening who are Vietnamese right now, and their questions have been translated. One of them is, if my friend is eligible with Medicaid, your provider list will be the same as Obamacare. May he choose the carrier? So that's the question, Liz.
So yes, if they're eligible for Medicaid and they apply, we, like I said, we have the largest network, and they do, number one, they can choose which MCO they sign up with, whether it be us, Anthem, or Silver Summit. Like anything else, we ask them to research, to really look at what each plan offers, because the standard Medicaid benefits are the same for everyone. But what's added value, you know, if you have a family that has somebody with chronic conditions or that really needs those support services, we offer that. Something for you to consider when you're making that choice. Yes, you do have the right to make a choice. You also will be able to choose your own primary care provider. If there is any question as to whether your doctor is in our network, you are welcome to call our member services department. Even if you are not one of our members, they will gladly check the provider for you to see if they are in our network. And you can also look for that information on our Medicaid, myhpnmedicaid.com website. It's for everyone. You don't have to be on our plan to access that site. And as a matter of fact, I recommend it because you can get an idea of the extra services that you'll have with our plan, if that maybe can help you make that decision.
Awesome. Well, Liz, thank you so much. And so much great information. Of course, we want to answer everybody's question. We have a limited time for our webinar today, but I just want to thank everybody who has come on and talking to us for this lunchtime live stream education series for ACDC. Of course, we have Joy Avendano with ACDC. We have Liz Maya, Sarah Portillo, Richie Duplessis, also with Health Plan of Nevada. And we've been working together, of course, for quite a few years now. It's such a great partnership. And thank you so much, everybody, for joining us today. If you guys have any other questions, of course, put it on the comments section. We will reach out to you. You can contact Health Plan of Nevada directly. We'll put that information on the screen as well as ACDC. With ACDC, again, right now, also just taking appointments, by appointments only. If you want any information from ACDC, do contact us that way. And thank you, everybody, again, for joining us on this live stream, and we will see you next week.
Thank you very much.
Thank you.
Stay safe.